Well, if prescription drug abuse was once Hollywood's dirty secret, the cat's certainly out of the bag. Since Michael Jackson's death, we're learning more about rampant abuse. Dr. Drew Pinsky is an addiction specialist, the host of Celebrity Rehab with Dr. Drew on VH1, and co-author of The Mirror Effect, How Celebrity Narcissism is Seducing America. Dr. Drew, good to have you here. Good morning.
Good morning, Ellen.
Okay, the toxicology report not due back for another 3 to 4 weeks, but we've heard so much already about the reported drug use that Michael Jackson, apparently all the drugs that he was using. Bring us up to date. Demerol, Diprovan.
Well,
what are these painkillers?
I mean, these are opiate painkillers. These are things that are highly, highly addictive. Michael had a history of having been admitted for opiate addiction years and years ago.
He canceled concerts in the past.
Right. So this is somebody that struggled with this for a long time, and yet clearly had access to these things from physicians. He got them, and I guess physicians, some don't understand that when you give opiates and benzodiazepines to an opiate addict, their disease is very active.
And you're talking about, I mean, these are powerful painkillers. I mean, Diprovan is something that only is used in surgery. And this is an anesthetic.
Oh boy, the Diprovan thing really even caught me off guard. That we just flashed on that medication there on the screen. And Diprovan is something that's used in intensive care units to keep ventilator-dependent patients unconscious. It's used as an induction agent for anesthesia. Used outside of a hospital. I have never heard of it. People say, "Are you astonished?" I'm more than astonished. I've never heard. It's outlandish to have somebody prescribed and given that medication outside a hospital. You can't imagine how bizarre that is.
As an addiction expert, though, we hear so much about the painkiller addictions. But this is not just a problem among celebrities, right? How prevalent is this even among our youth in America?
Right now, that's where the really big problem is. You know, quoting data from the National Association of School Nurses, 2,500 12 to 17-year-olds will abuse a prescription medication for the first time today and every day.
12 to 17-year-olds?
2,500 today in this country. One-third of high school seniors say they abuse prescription drugs. I mean, it is a massive problem. And think about it. We've become very casual about it. Everyone should open their medicine cabinet and look in there, and you will find a benzodiazepine, a sleeping medicine, an opioid pain left over from a dental procedure or something, and our kids see that. They see the casual attitude.
And that's where they're getting it from.
And they're getting it from home. Not as though the parents are negligent. We just have adopted a casual attitude, and we need to talk to our kids about this.
Well, let's talk about what is going on. As we showed in an undercover report with our reporter in Hollywood, Jeff Rossen, showed us how easy it is to get prescriptions for these powerful drugs with just having cash in Hollywood. Take a listen to how he used our undercover decoy, and he describes to Jeff exactly what he was able to get.
Okay.
This is a suicide cocktail on paper. Could these drugs kill me? They could kill 20 people.
I mean, he got enough drugs to kill, as you heard, 20 people.
Yeah.
I mean, this is pretty prevalent in Hollywood celebrity culture, right?
Well, yeah, it's prevalent everywhere, unfortunately.
Right.
And here's the problem. The very, very wealthy and the powerful and the very, very poor have very much in common when it comes to their health care. They have trouble getting good health care. The problem is the standard of care in the healthcare community is the standard because it's the best. And people that tend to become celebrities tend to think that they need special care. Well, when you get special care, you get substandard care most of the time. Doctors, you know, we have our own narcissistic liabilities ourselves, and we sort of could be seduced by being a celebrity.
Or you've got somebody giving you cash.
Well, it's not even so much the money. It's like, oh, this bigger-than-life person thinks I'm a good doctor. And you can imagine Michael Jackson or somebody like that coming, you know, Natalie, you're the best doctor I've ever had. Only you make me feel good. And you think, oh, my goodness, I'm helping this guy. Comes back in 2 weeks later. You know what? I'm paying you all this money to give me what I need, and you don't give it now. I'm going to tell everybody what a horrible doctor you are. Well, so it gets seductive.
In fact, your reality show, Celebrity Rehab, you treated a celebrity, Jeff Conway, known for his roles in Grease and Taxi, Kaniki in Grease. And he told you, as well as our reporter Jeff, who interviewed him once again, that he could get just about anything he asked for. How did you then help him break that habit?
Well, you know, what we do is we get him off the drugs. And in our world, about the vast majority of times, the patient come in telling us on a scale of 10, their pain is 20 out of 10. I mean, Jeff is a chronic pain patient. Just by taking them off the opiate pain medication, 2 weeks later, they will tell us, almost without exception, the pain is a 4 or under. The pain actually intensifies, the opioids actually intensifies the pain, and doctors aren't aware of it, patients aren't aware of it, and then we confront the addiction. And even in Jeff's case, you know, you get good treatment, we confronted it actively. You have to have the active participation of the patient, and even then, the outcomes are not that great. So
there have, though, been success stories.
Absolutely.
Robert Downey Jr., Britney Spears. How were they able to kick the habit?
Britney is a great example of what happens when the people around the individual are enlightened and listen to a good team and take their advice and do something very, very difficult. The one thing people are afraid to do is risk their access or their jobs to a celebrity. In this case, imagine this. Her parents stepped up and risked their access to their daughter. Can you imagine if they'd done that conservatorship and the daughter had said, Brittany said, I hate you, I'll never speak to you again. They risked that, but did it to save her life and trusted the team, and the woman got good care. Brittany's alive because of it. There's very few celebrities have that kind of enlightened people around them who are willing to take those kinds of risks.
So is it different than when you're dealing with a celebrity, when you're working with them to try to break the habit?
Well, it is different. It's the reality is it's no different.
Right.
Humans are humans, and that's the reality. But this world they live in makes it more difficult to keep them engaged in the treatment process, because they do tend to be insulated from the world. They tend to be surrounded by people that give them what they want. And in fact, what celebrities often need is confrontation, frustration, and things that they don't want.
They need people to tell them no, which
exactly.
they don't get.
They don't get that, and it's very hard for physicians to do that themselves.
All right. And last question, I mean,
Yes.
what can we do to try to put this problem to rest?
I think we can really all start in our own home, that realize that these medications in our medicine cabinets are not benign. All medication. I grew up with a physician father who was a family practitioner. He raised me with the idea that all medications are dangerous. We've got to remember that and look in our medicine cabinet and talk to our kids about the potential risks of these things that we've come to take so casually. We start there, and then my profession needs to take a really good look at itself, particularly as it pertains to its relationships to powerful people and celebrities. And what I've told in interviews with my peers, I say, don't attempt this alone.
Yeah.
Celebrities need teams of people around them, and if they don't have that, they will run amok.
All right, Dr. Drew Pinsky, as always, great to have you here.
Thank you,
Thanks so much.